Hey lovely people, welcome to Learning with Violet Okolacha, and in today's video I will be giving you 6 top tips to pass your A to E assessment. To be honest, 70% of failing OSCE exam actually comes from assessment. So if you know the 6 top tips, you'll definitely smash your OSCE exam. Now guys, without wasting any of your time, let's dive directly into the video. But before we do, I want to specially congratulate the 5 persons who sent me emails yesterday to tell me they passed their OSCE exam. I'm super excited for you, and if you're writing soon, I can't wait to congratulate you. Like I keep saying, OSCE is simple and nurses are brilliant. All right, so now let's get directly into the video. Do well to like this video, do well to share this video, and don't forget to subscribe. Come on guys, let's get directly into the video.
Ryan Little.
All right guys, so welcome back to my channel. Okay, I'm trying to be very audible because a lot of people said the last video I did, it wasn't very the sound was bad. Okay, so I'm trying my best to be audible in this video. All right, so the first tip for you to pass your A to E assessment, number 1, make sure to correctly identify the patient ID with their wristband and do your allergy check. I repeat, make sure to correctly identify the patient ID with patient name with their ID and do your allergy check. How do I mean? Now, my name is Violet. Already, you must have checked for scene safety. You must have provided privacy for your patient, and you must have done your hand hygiene. So after checking for scene safety, after providing privacy, after doing your hand hygiene, then you can read your scenario. So you have to follow OSCE systematically the way it is. If your assessor tells you, Violet, assume all checks have been done, then you can forget about saying I check for scene safety, I provide privacy. You can just go straight to your hand hygiene. Okay, now after doing your hand hygiene, read your scenario. Why? Just so you have an idea of what exactly the assessor wants you to do in assessment. Is it dying patient? Is it asthma? Is it cardiac? Is it pneumonia? Is it what do you call it? Is it pre-op? Is it post-op? Is it homelessness? So you have to read your scenario. Okay, so after reading your scenario, go straight to the patient. Correctly identify the patient details with their wristband and do your allergy check. How do I mean? Some people will say, my name is Violet. I'm one of the nurses looking after you. Can you please tell me your full name and date of birth? The patient will tell you. Now, when the patient tells you, make sure you are using this paperwork to look at the wristband. You know, some people will just start looking at the wristband. I have here Ailey Brook, and that's a fail because you are not comparing the paperwork with your wristband. Okay, now always compare the paperwork with your wristband. Can I double check with your wristband? And the patient tells you, yes, nurse, please go ahead. So I'm looking at this and I'm looking at the wristband, and then I can gladly say, assessor, I have the right patient. The next thing is to say, do you have any allergy? Do you get? So you have to do this systematically. And let's assume the patient tells you, nurse, I have no allergy. Look at the wristband, okay? And say, okay, that's why you're wearing a white wristband, because you said you don't have an allergy. All right, now why do people fail this? I'll read somebody who failed this and I'll tell you why the person failed. Candidate failed to identify the patient with the paperwork against the wristband. Failing to correctly identify the patient with the paperwork and the wristband may result in wrong care delivered to wrong patient. Did you see now? So if you don't correctly identify the paperwork with their wristband, it is a fail in OSCE exam. I hope we all got the first point correctly. Now, guys, let's quickly move to the second point. Before we move to the second point, for community, I know somebody is saying NOS V. What about for community? Now, for community setting, the patient does not wear a wristband. When we talk about community setting, we talk about patient that could be in their house. You understand what I mean? Now, if you happen to have a community setting, you could say, my name is Violet. Can you please tell me your full name, date of birth, and first line of address while I double check with my paperwork? Does that make sense? So when the patient tells you, for instance, my name is Ailey Brooke, my date of birth is 15 February 1940, and my first line of address is flat 1, number 11, Gagaga Place, CDDDD, and it's okay. But the paperwork I have on my hand, I have the right patient. Then you ask the patient, do you have any allergy? So that's all about the first point. So tick. Now, the second point, you have to gain consent. Very important. You have to gain consent. Now, the next thing is, the reason I'm here this morning is to carry out an A to E assessment on you. Is this a convenient time? Most people try to make it difficult. They try to tell you, most people make it difficult for themselves. How do I mean? The reason I'm here is because I read in your scenario that you are dying and I'm here to confirm. No, don't talk too much. Some people will even say the reason I'm here is because you are a known heart failure patient. No, now, don't make it hard. Don't make it long. OSCE is simple and nurses are brilliant. Go straight to the point. The reason I'm here this morning is to carry out an A to E assessment on you. Is this a convenient time? And the patient tells you, yes, it is a convenient time. That's all. I'll leave you with a call bay if it's a hospital setting while I assemble all my equipment. If it's a community setting, give me a shout if you need me. I just want to assemble all my equipment and do my hand hygiene. Do we have any question at all? No. So that's number 2 point. You must gain consent. Okay, now you don't have to ask the patient, do you want to use the toilet? Do you want to use the washroom? Are you comfortable? Now somebody will say, Nurse Violet, are they not important? They are important, but they won't give you any mark. Yes, if you ask the patient, are you comfortable? Do you want to use the toilet? There's no need for that. Just try to go straight to the point so that you can maximize time. The aim of assessment is to be able to maximize time within your 19 to 20 minutes. Okay, now the third point, I'm trying to scream, like I'm trying to be audible so that nobody complains. You understand what I mean? That they don't hear me. I've ordered a microphone, but it's not come yet, okay? Now, the third point. You should be able to do all the observations and chart them correctly. Be it on your news charts, be it on your GCS charts, be it on your MOS chart. So you must be able to carry out all observations and chart them correctly. Now, what do I mean to say? When you come back, please do your blood pressure together with your saturation. Do your blood pressure together with your saturation. It saves you time. For instance, Mrs. Haley, I've done my hand hygiene. Assessor, can you confirm my equipment is clean and ready for use? And the assessor says, yes, that's correct, Violet. Please proceed to your patient. So when I get to the patient, Mrs. Haley, I'm back. Are you happy for us to continue? And the patient tells me, yes, Nurse Violet, I'm happy for us to continue. Can I please see your left hand, or which of the hand do you prefer for your blood pressure? Now, let's assume she tells me, Nurse Violet, can you use my right hand? I can assess your right hand. There are no redness, there are no swelling, there are no infection. please, have you ever had surgery on your right hand? She tells me no. So now I will tie my cuff 2 to 3 centimeter from the cubital fossa, or I will tie my cuff covering 80% of the upper arm. Whichever one you use of the two is very correct. All right. Can I see your nail beds, please? I can see your nail beds. There are no redness. There are no swelling. I do a capillary refill. It's less than 2 seconds and I put my probe. So now I have tied the cuff on this hand. I will do a capillary refill on this hand and put my probe. Okay, so now I will on the machine. So the same time I'm getting the blood pressure is the same time I'm getting the saturation. You see, it does save time. All right, so then please do me a favor, pick up your news chart. On your exam day, the patient's name will already be written on the news chart. The patient date of birth will already be written on the news chart. The patient date of admission will already be written on the news chart. But you have to write the date and the time. So write your date and your time on that tiny column, making sure you don't exceed 1 or 2 lines. Now, after that, chart your observations directly on the news chart. Most people will go and chart their observation on a piece of paper. Write your observation in a piece of paper. Remember, you are also going to transfer it to your news chart, and that is time wastage if you ask me. So what am I saying in essence? As soon as you do the observation, chart them on your news chart directly, and remember to check several times. Like if, for example, I do my BP and my saturation together, and my BP is 140/80. Remember, when you tie the cuff, after tying the cuff, do not on the machine. Check the nail beds, put your probe on the other finger, then on the machine. So at the same time, you're getting the blood pressure, and at the same time, you're getting the saturation. So when you chart the blood pressure, assuming it's 140/90, chart it on your news chart. Look a second time that you charted it exactly at 140, and look the third time that you charted it exactly at 90. Okay, so you chart the saturation. Remember, we only use scale 1. Put a dot on the saturation, the score you got, check 3 times, because a lot of failures come from news charts, and that's all until you finish your news chatting. So why do people fail news chatting? They will reply, some of the ones I've seen, they'll tell you candidate fails to document their observation correctly. So make sure you chat correctly on your news chat. Check 3 times to be sure you chatted correctly. Total your news score. Tell them the news score, the monitoring frequency, and the escalation of care. Now, after that, you have to conduct and carry out your A to E assessment. A lot of people fail this A to E assessment. You have to talk about the airway, breathing, circulation, disability, and exposure, and go ahead to tell them activities of daily living. For airway, because you and the patient are conversing, both of you are having a conversation, the patient is talking to you, tell them you think their airway is clear. Can they cough for you, or can they take a deep breathing breath? And as the patient does that, you tell them that I think your airway is clear, but do you think you are having any obstruction to your airway? If the patient says no, that's fine. And if the patient tells you yes, you escalate to the doctor. Then you move over to breathing. Breathing is respiration and saturation. Tell them, I did your respiration for 1 minute. The rate, the rhythm, the rhyme is okay. If it's okay, you know what? If it's okay, if it's within 12 to 20, of course, there is no stridor, no use of accessory muscles, no wheezing, no coughing, no visual sign of respiratory distress, okay? And of course, if it's high, it's vice versa, okay? I did your saturation is normal or is high, you understand, or is low. Don't worry, that's it. Now we go over to circulation. Circulation is talking about the blood pressure. Circulation is talking about the pulse. And circulation is talking about the capillary refill. So tell them you did their blood pressure. Tell them the score of their blood pressure. Tell them if it's normal or if it's high. If it's normal, that's fine. If it's high, you have to escalate to the doctors, okay? Tell them you did their pulse, the strength of their pulse, the rhythm of their pulse is okay. You are happy with their pulse. And if the pulse is high, tell them you did their pulse, the strength, the rhythm is not okay. Their pulse is elevated. You're going to escalate to the doctors. Just that way. And you did a capillary refill on them. Tell them they are properly perfused and there's no cyanosis. Then you move over to disability. For disability, ask the patient, do you know where you are? And when the patient tells you, nurse, I'm in the hospital, so it means they are oriented, if of course they are in the hospital. But if, for example, the patient is supposed to be in the hospital, the patient is telling you they are in the supermarket, orient them to time, to place, and to person. And also for disability, ask them, are you having any pain? And of course, you know what to do if the patient is having pain. Ask them of their pain score and escalate to the doctors. Now, the next thing is, are you passing good amount of urine? Are you eating and drinking okay? How is your blood sugar? Now that's all for disability. Then you go ahead to exposure. For exposure, all they need from you is tell the patient their temperature. I did your temperature. Your temperature is 37. That's normal. I'm happy with that. If it's not normal, also say it. Do you have any rash, swelling, bruises in any part of the body? And the patient will tell you if they have or not. Then you ask that brings us to the fifth step. The fifth step is like an holistic assessment, or what we call activities of daily living. What are the activities of daily living? If you don't like to talk too much, you can just say, do you have any concerns for me? But if you're the type that you feel like, oh, I can talk, you can just say, how is your mobility? If the patient says they are not independent, that they mobilize with Zimmer frame, walking stick, walking aid, make sure you refer them to the occupational therapy and physiotherapy. Now, the next thing is, are you eating and drinking okay? Are you sleeping okay? Do you smoke or drink alcohol? Then, of course, if it's end of life, ask them, do you have any spiritual need you want for us? And that's all, my darling. You do your hand hygiene, and that is all about A to E assessment. So tell me if you have any concerns on the YouTube channel, and I'll be able. And remember to share, like, and subscribe. I can't wait to congratulate you all writing your OSCE exam soon. I love you all. Bye.